Today on Dr. Phil.
My sister is a hypochondriac.
She's slurring her words. You take over 80 medications.
Is she really sick?
You don't deny that she has some physical complications.
Nobody has 72.
Or just obsessive?
My sister has hundreds of wigs. Everything is you.
It's obvious you cannot stand me.
If I didn't love you, I wouldn't be here.
Now,
You have verbally abused
don't
me
talk to me.
for 10 years.
How dare you, Mom? How dare you?
the face-off with her family.
Mom! Stop!
You need to sit down and listen to your daughter.
This child has been given everything by me.
If you walk off this stage, our relationship is done.
Let's do it.
Have a good show, everybody. Here we go.
This is a safe place to talk about hard things.
Stand by, Dr. Phil.
I'll try to be an emotional compass and point you in the right direction.
In 5, 4.
I am not giving up on you.
Go, Dr. Phil.
Okay, I want you to take a look at this family. Beautiful family, right? Perfect in every way. Beautiful parents, gorgeous children. Well, who would believe what one of them has been diagnosed with over 70 medical and mental health conditions, has ritualistic obsession, and barely gets out of bed for more than 2 hours a day? Which family member are we talking about? Well, we're talking about 43-year-old Shamita. Her sister Dana wrote the show saying that Shamita's illnesses are destroying this entire family. She says the Shamita saga is ridiculous and it just needs to come to an end.
My sister Shamita is destroying our family. Shamita's illnesses cause chaos in our family because she's always sick. There's never a break. There's always something wrong with my sister. My sister has been diagnosed with bipolar, OCD, depression, anxiety, pulmonary disease, cystitis, blood clotting neuropathy, dysmorphia, lupus. My sister is a hypochondriac. When she does go into the doctor and they say maybe this is leukemia, she gets excited. I almost feel like she wants to have cancer. Shamita uses her illnesses to get attention. If we go out to lunch and somebody says, "Hi, how are you doing today?" My sister would say, "I've been very ill. I was just in the hospital." These are strangers. My sister is always pill popping.
I'm so nervous. I need to take a Xanax really bad.
We'll go out to eat. She'll pull out this huge pill box to get that reaction of, "You take all that medicine?" And of course, my family, we're just like, she's so doped up on these medications, she can't function. She'll take her sleeping medication in the morning. She now is sleeping all day and up all night. My husband and I have always been very worried about Shamita's kids because they don't have a mom. The kids have had to take care of themselves. She's very OCD. She's obsessively cleaning. The house is over-decorated. There's animal print everywhere. Every wall space is used with family photos. My sister has hundreds of wigs, just rows and rows of wigs.
I don't know. I don't think I really like this one.
Now it's Hello Kitty. Hello Kitty has exploded in her house. She has her grown husband sleeping in a Hello Kitty comforter. That's not normal. She's not living. She's 43, and it looks like she is a feeble old lady. I think my sister is severely miserable in her life. I do think she gets a payoff from it because she gets attention, but at the same time, it's killing her. I don't know how much longer she can survive this.
Okay, Dana, you have two concerns. One is for your sister,
Absolutely.
just as an individual, and then you say it's destroying the family as well.
My sister's illnesses are consuming our lives. It's destroying our family. We don't know what to do anymore.
You think she's a hypochondriac or whatever term y'all put on it?
Absolutely. We don't know what's legitimate, There's so much. I mean, from the OCD to the bipolar, dysmorphia. It's so much. It's so frustrating. What's real? What's not real? We don't know.
And you've been trying to figure this out for like 15 years.
Oh my God.
Was she always this way?
No.
I mean,
Not
when
always.
did it start? Can you look back and identify a date, a time, an event, a period where, bang, this went over the cliff?
I mean, my sister has been through one traumatic event after another in her life. We've had domestic violence in our family. She was raped in college, and I think that was a big start of all of this.
Okay, and those are real. Those aren't imagined. There was chaos
happened.
and violence in the family.
Yes.
She was, I believe, date raped.
She was date raped, absolutely.
In college.
Yes.
And you don't doubt that took place.
No, that absolutely happened.
Okay, so you know that to be true. So she's had these stressors in her life, and you think that has triggered this?
Right, because I don't think it's ever been dealt with.
And then she uses her illnesses as an excuse for bad behavior, right?
She uses it as a crutch, as an excuse.
Like what bad behaviors? What is she doing besides blowing up the house with Hello Kitty and sleeping all day?
Right. The obsessiveness is definitely there, but she did have an affair, and I think she uses bipolar as an excuse for that, of making bad decisions.
Let's learn a little bit more about her. Dana says a lot of these illnesses are in Shamita's head, but Shamita says, no. I know pain when I feel it, and I am really in pain. She says she's just living in a hell, and she's having to do it by herself because her family just doesn't support her. Take a look.
The most hurtful thing my sister has said is that if I was not her sister, she would not even be friends with me. I don't know how my sister can say that I've torn the family apart. When I found out that I was ill, I felt like a failure, worthless. I felt like I had let my family down. My family does not believe my ailments to be 100% true. I just wish that I would die in my sleep so that I would not be a burden to my family anymore. I am in excruciating pain, 24 hours a day. I was diagnosed with bipolar depression, anxiety, PTSD, ADHD, OCD, salmonella, hydrodistension, endometriosis, pulmonary embolism. I take Ambien late at night, so I sleep all day.
You fell asleep on the toilet.
I don't remember.
I know. Those are the things that scare me.
I used to work graveyard shifts, so my doctor says I have shift work disorder. Presently, I have 5 active doctors, but in the past 12 months, I've seen approximately 35 doctors. I swallow all these at one shot. People think I like this box. It's not a brag box. I'm so offended that people think that this is a brag box. The current things that are really life-threatening are my abdominal issues. I go 18 days without going to the bathroom.
Did you take the new medication to make you go?
Mm-hmm.
No result.
No result. I feel like I'm carrying 2 alien babies in my stomach. My lupus, all my teeth are rotting to where I need to have all my teeth replaced. My organs are falling apart, and nobody will believe me. I've accepted I'm a disabled person. No one else has.
Oh, okay, now she's going to join us in just a second, but is that fairly typical of her?
Yes.
Because I got to tell you, she's high as a kite.
Absolutely.
In that tape, she's slurring her words.
Right.
She's in a daze there.
Right, and all of our phone calls are that way to where you can't understand her.
Your sister Shamita missed 3 flights
I just found that out.
trying to get here to the show.
That's part of the drama, the attention.
Yeah. Tell me why you're emotional right now.
I'm very, very sick. I don't understand why they don't believe doctors' diagnoses.
You've got 72 diagnoses in the last 10 years. And later, why did you miss 3 flights? So I've had over 10,000 guests. You're the only one to ever miss 3 flights.
Well, I'm sure I was blamed. I'm usually blamed for everything.
All right, so Shamita, come on out. Shamita, Dr. Phil, have a seat right here if you would. So, Shamita, tell me why you're emotional right now.
Well, I'm very blessed to see you. I've been watching you for so long, and I probably on my own would have reached out to you for help for myself. But I just kind of stopped caring really about me a long time ago. And I'm crying right now because circumstances have changed. Because I sadly found the letter that my sister wrote about me to your show, and it hurt me so badly.
It hurt you that she wrote?
Yeah, because she lied to me. She read to me the letter she said she was sending you, and I was totally happy and thrilled that she loved me enough to send you a letter. It's the first time she's ever paid any interest in my illness. But the letter that I found that she left accidentally on my computer was a 12-page letter of how she feels about me, and it was so hurtful.
A 12-page letter she wrote to me? I didn't get a 12-page letter.
No, there's no 12-page letter. I think she's talking about my pre-interview that was emailed to me.
Oh, okay. We did interview her and ask her, just like we did you. We asked her a lot of questions.
Well, I'm just saying, whatever it was, I kind of already knew for years that she had feelings about me, and I guess it just confirmed that I was right all along.
Yeah. Okay, so I'm now confused. Are you glad you're here or not glad you're here?
I want to be here because I need help because I'm very, very sick, and I need my family. I'm hoping that you could try to help my family understand my diagnosis is. I don't understand why they don't believe doctors' diagnoses.
Well, you have a lot. In the past 10 years, you've had acute bronchitis, acute gastritis, you got allergy, anxiety, ADHD, predominantly inattentive type, autoimmune disorder, bipolar, bladder infections, blood coagulation disorder, body dysmorphia, bypass complications. I mean, in fact, you've got 72 diagnoses in the last 10 years. And you gave them to us, and so I listed them here so we would have them. Does that seem right to you? Does it seem reasonable to you?
No, but when the doctor runs the blood tests on me, that's what I'm just giving you what the doctors at the hospital give me.
Right. Do you think that you're on death's door? Do you think you just have a chronic situation you're going to have to struggle with for the rest of your life? What do you think?
I've been struggling for 10 years. Ever since I had my gastric bypass, I think I made a poor decision by doing it. And I was never a sick person before.
Okay, in terms of your general condition, how much of your impairment would you consider to be psychological in nature?
Are you meaning, do you feel that I'm having sicknesses because of psychological issues?
No, I mean exactly what I said. I mean, in your opinion, in terms of your overall health, functioning, adaptability, coping skills, energies, wellness, sickness, whatever, how much of it, if any, do you think is psychological in nature?
Maybe 30%.
Do you think that you're medicated to the point that it puts you in kind of a fuzzy zone?
When I first was diagnosed,
I mean now, like today.
No, because I'm not on but one antidepressant.
Shamita, you're slurring your words.
I'm slurring my words because I'm very upset.
But you sound like this all the time. Every conversation, you're slurring your words. You sound medicated 24/7.
I'm very weak. I was diagnosed with lupus, systemic lupus, just a few weeks ago.
Right.
And the doctor told me I needed to have a transfusion right away because my blood cell count is very bad.
How'd that go for you, the transfusion?
They told me that it has only been tested in white Caucasian females. He said that
So you didn't get the transfusion?
I could not get it. Of course, I'm going to be the way I am right now because I'm weak.
Yeah, well, I'm just asking your assessment. I'll give you mine before we're done. I'm just asking what you think. Do you think that you're 100% focused and sharp, or do you think you're a little fuzzy?
I'm definitely not focused and sharp. I can't be.
Okay.
Not when you haven't been to the bathroom in 18 days.
Okay.
I don't think anyone could be if they have that issue going on. Burning urination. I mean, lupus, all chronic fatigue. You know, every day of life. And then having people tell you that I'm supposed to give it to God and be healed in Jesus' name. Well, I'm there every Wednesday, every Sunday, saying, Lord, please heal me.
Do you think I can be of some help to you today?
I'm hoping. I was hoping because you're Dr. Phil.
I am Dr. Phil. It's
I know, it's your show.
written all over the wall.
I know, I watch you every day.
That's good. I'm glad.
I'm very isolated, so you're my friend.
Yeah.
You wouldn't even be my friend if I wasn't your sister. Oh my God.
If I didn't love you, I wouldn't be here. I don't know how else to prove it.
And later, is this your medication box?
That's what I live on.
She is destroying our family. Everything is about her.
It's obvious. You cannot stand me. She has resented me our whole life.
Why did you miss 3 flights? So I've had over 10,000 guests. You're the only one to ever miss 3 flights.
My husband was totally in charge of that.
I'm asking you these questions as kind of a test, frankly, because I'm trying to assess your level of insight, how able and willing you are to look at and see yourself in a realistic and objective way.
Well, I'm sure I was blamed. I'm usually blamed for everything in my family, always. So, but I wasn't given, you know, he knows that he has to wake me up because I don't sleep. I don't go to bed till 5 in the morning.
But you choose that.
No, I do not choose that, Dana.
Well, you actually
I stay
told
up
us
and go to the bathroom.
you actually told us that you chose that.
After a while, I worked 21 years in the airline industry. I worked graveyard shift.
But you told us that you wait until very late to take your sleeping medication because being up during the day, as miserable and in pain as you are, makes for a very long day, so you'd rather just sleep through it. That's what you told us.
There's two reasons.
Well, would
Shamita,
that be one
I
of
work
them?
the graveyard shift. Eric has worked the graveyard shift. That's not an excuse.
Do you suffer from depression and abandonment and loneliness? Have you been raped?
No.
Have you walked in my shoes, Dana?
I haven't, Shamita.
Okay.
I haven't.
So then don't compare me to you and Eric.
Is she irritating you right now?
Yes, because I'm just seeing the words on the paper saying that if we were not sisters, that she would not even be my friend. And we have grown up, our parents are in the ministry, and we have been in church our whole life. And you wouldn't even be my friend if I wasn't your sister. Oh my God.
Shamita, I did not say that.
Yes, you did.
I know I said it. I didn't say it to hurt you. I just was saying it because we are so different. We're so different. That's why I said it.
Love me as a sister?
I do love you. If I didn't love you, I wouldn't be here. I wouldn't have written in. If I didn't love you, I don't know how else to prove it.
She believes that you have some physical issues. I mean, she does. She told us that. She says, some of this is for sure, but she says she feels like it's kind of taken you over and become your identity.
It's all you live.
She said, that it's just become your identity. She said, I almost feel like she wants cancer. I almost feels like she wants to be sick. She tells everybody she's sick. She said, we go to the store, we can just walk past somebody on the sidewalk and she'll start telling them how sick she is. That you've become obsessed with it. Is that possibly true? Has it consumed you?
It consumes my life because I'm at the doctor 4 out of 5 days a week, every week of my life.
Yeah.
It took away my livelihood. It took away my joy of 21 years at my career, something that I was good at. So, I mean, it does. It consumes your life.
She's concerned that you're so consumed with it that you basically don't have anything left for your kids.
Well, I think that my children will tell you different, except for my daughter, who decided to go live with my sister and is very influenced by my sister.
Mm-hmm. All right, well, let's take a break. Next, Shamita asked for a glass of wine before the show. And I want to talk about why she was upset with her friend for taking up all the time in the makeup chair. These are just issues I don't usually talk about, but we're going to talk about them.
This is my favorite cup of ice. I love the smell of the freezer. I could live on ice as a meal. Well, my fascination with wigs started way back when. It gives my husband something to look forward to coming home to. Yeah, I think this looks pretty hot.
For at least the past 15 years, I feel like Shamita's illnesses have affected our lives. My family is always fighting because we don't know what to do.
I can't drive right now. I'm trying to not hurl over.
We don't know how to help Shamita. There's never a solution to fix my sister. There's never a break. There's always something wrong with my sister. It's exhausting.
Why were you upset with Kim?
Because I brought her here because she's a wonderful friend. She's a great supporter of me, but she was running late this morning, and I felt like she was she was making your staff upset, and it upset me, and I got in a panic.
I don't even know why Kim's here.
You're Kim, right?
Right.
Hi, Kim.
Hi.
I'm glad you're here, by the way. Welcome to the show. I'm glad you're here.
And I knew that would be the result.
And you this morning you got up upset with Kim because she got all the attention in the makeup chair?
No, that I did not get ready. I didn't get any time to get myself prepared. I felt I looked horrible. And they did tell me that they ran out of time to be able to do my hair.
You told the producer that Kim was being selfish by doing what she was doing.
By not allowing me to have time to get ready. She was making me more nervous.
You both look very nice,
Thank you.
I think.
I
What
still
do I
don't
know?
understand why she's here, though. You say she's your supporter, like y'all have been friends for so many years, but I mean, there was a time where y'all weren't even speaking to each other. And then all of a sudden, y'all are friends again. I don't understand why she's here.
We've been friends for 9+ years.
Kim, what's your understanding about why you're here?
Well, Shamita asked me to come mostly for moral support, but also as someone that's been there from the outside looking in all this time, not actually being in the family.
Did you give Kim some of your medication this morning?
Did I give Kim
Some of your medication this morning?
No, I put some of my medication in her box, and then I got it out before I left the room.
Why would you do that?
Is this your medication box?
Yes, that's what I live on.
Yeah. And you put some of your medications in here?
Yeah, because
This
her and
box
I are on one
terrifies me.
medication that's the same.
You guys,
Because she takes it with her everywhere.
Did you take anti-anxiety meds this morning?
no, I wanted to, but they took my box. They said you wanted my box.
I wanted to see this.
Because I was having a panic attack.
What is it you want her to do to make you happy? What could she do to make you happy?
I've written her 3 or 4 letters over the year that she's never responded to. Now I have my answer of how you feel about me.
Just get it out here, sisters. This is not the time to mince words. What do you think's going on here?
She is destroying our family. Everything is you.
What did she say that was offensive to you?
I'm ruining my entire family's life. That my son left because he couldn't handle me. My daughter left for the same reason.
Is that true?
My son said she's full of it.
We have 2 sons.
Yes.
Which one are we talking about, Sebastian or
Yes.
Sage?
Sebastian. And Sage is very upset with her.
Yeah.
I'm sure he is because of the things that you've probably told him.
No.
All right,
Things
let's
that I don't even-
just get it out here, sisters. So what is it you're concerned about with her? What's the bottom line? I mean, this is not the time to mince words. What do you think's going on here?
She is destroying our family. Everything is about her. Anytime we get together, it's about her. It's always about her. She has not been there for the kids. My parents and my husband and I have helped raise those kids. And I know that's going to piss her off.
But you think she's neglected the children because she's so focused on
Absolutely.
herself?
And those are Sebastian's words. He has been emotionally been there for you since the age of 13. And to say that you and Sebastian have had a great relationship and he only
We
left
have.
at the age of 18 because it was just time to move on, Shamita, that is not true. Nobody can handle it anymore.
He says what he has to say to please you because you hold it
No,
against
I think he
him.
says what he has to say to please you.
You think that she's not physically as sick as she thinks she is, correct?
No.
You don't deny that she has some physical complications, as
Yes.
many people do.
Absolutely.
Along the way.
Nobody has 72.
But you think she's blown this way out of proportion.
Yes.
I don't
For
have
years.
72. Have you taken one day of your life to go to any of my appointments? If you had,
I haven't, Shamita, because I
Okay.
can't take it anymore. I have distanced myself from this family because it's always about you, and I can't take it anymore. Everything is you, everything. And I understand why Mom and Dad have been there for you. I get it, because you need it. You need help.
So, and you don't think you do?
Mom God knows I need help because I don't know what to do anymore.
Mom and I, and Dad and I were talking about this. It's obvious. You cannot stand me because I
can't stand this, Shamita.
Because I can't help.
My old sister back.
I can't help that I'm 6 years old, was born 6 years before you, and you hate me for it.
I have no idea what that's about.
It's not funny. It's not. She resents me because she made a comment the other day that she came in after me and ruined my mom and dad's little family. It was just me, my mom, and my dad. And she has resented me our whole life.
Is she possibly right?
Oh, you just pissed her off.
What?
Oh, you just pissed her off.
Possibly right about what?
That you are not as sick as you believe you are. That you...
Dr. Phil, I would love to not be sick. If anyone would want to live in hell to where they cannot have a bowel movement for 18 days and be in that kind of pain, why would, I know you're a very educated man. Why would I want to make these things up? I'm in horrible pain.
Oh, well, let me answer that.
I'm in so much pain.
No.
I would rather just shoot me now so I don't ruin the family.
Well, that's one option, but how about, if that's true, how about we take a better option, which is if there's a possibility to get a return to health for you? What if there's a return to health for you? What if we could do that?
That's what I've been searching for. But since nobody believes I'm sick, I cannot believe this. Then why am I $30,000 in debt in medical fees?
Shamita has been prescribed over 80 medications.
I don't understand why these people are laughing.
It's a shock. Wow, that's a lot of medications. Make eye contact with me. I believe you are sick.
Right.
I believe you are sick. I believe you have physiological anomalies and ailments, and I think you have psychological anomalies and ailments. And I think that, see, people misunderstand hypochondriac. They think you're a hypochondriac, right? I mean, that's what you've said. You think she's a hypochondriac. Family members have said that. And, there's kind of a new term for that now. This is a somatic symptom disorder, and I want you to read this. Very high levels of worry about illness and tendency to appraise symptoms as unduly threatening, harmful, and often think the worst about their health. Also, one or more distressing and significantly disruptive somatic symptoms present. Okay? Now, let's think about that for just a second, okay? Take a look at that. Very high levels of worry about illness, so definitely true there, correct? Mm-hmm. And tendency to appraise symptoms as unduly threatening, which means you tend to overinterpret or overreact to the symptoms, that you exaggerate them in some way, in your own mind.
No, I don't feel that.
Okay, well, often think the worst about their health. True? You think the worst about your health?
Over the last few years, yes, because I've gotten scary diagnoses.
And also one or more distressing and significantly disruptive somatic symptoms. So a physical symptom, one or more that is actually distressing to you. Like you haven't been in the bathroom for 18 days. That would be a somatic symptom. It would be distressing to you, right?
No, because it's just not normal. I mean, at my age, right. The doctors say that's not normal.
So it seems that a lot of this would apply to you. The only thing that you would disagree with is that you overinterpret symptoms or think they're unduly threatening. Here are a few of the characteristics. I just want you to consider this. Distress or disruption of daily life due to one or more somatic symptoms. So is your daily life disrupted?
My whole life has been disrupted.
You just said, I keep this room bright and cheery because I'm in here 15, 20 hours a day, right? I live in this room. I even have my Hello Kitty microwave in here so I don't have to go into the kitchen to prepare meals.
Yeah, because I'm too fatigued to even want to get out of my room.
Yeah, too fatigued to even want to go to your room. Disproportionate and persistent thoughts about the seriousness of one's symptoms.
Yeah, I think.
I would check that one off for you. Persistently high levels of anxiety about health or symptoms, right? Mm-hmm. Excessive time and energy devoted to these symptoms or health concerns.
Yes.
You say you go to doctors 4 or 5 days a week. You've got a box of pills that are huge. You take a lot of medications. Shamita has been prescribed over 80 medications. Over 80 medications. I don't wonder that.
I don't understand why these people are laughing.
They're laughing at it's a shock aspect. It's a shock aspect.
It's a shock to me. The doctors are the ones giving you these medications and saying you need to take these because you're sick, and if you don't take these, you're not going to get better.
Wow, that's a lot of medications. Well, and that kind of taking that many different medications in that concentrated fashion across a period of time can definitely disrupt the homeostasis of your body. It can get you out of balance and make you sick. The current ones you're taking are on the screen now. So that's the list you gave us, and boy, oh boy, oh boy, that's a lot of medication to be taken, and some of them work at cross purposes.
Yeah, but
some are up and some are down.
Well, that's our frustration, is who's talking to who? Is she being honest with all the doctors? Like, this does not seem normal.
Okay, do you know what diagnoses I have?
No, yeah, you gave us everything. I have everything. 140 pages of medical stuff that you gave us. So yes, I know the diagnoses.
So
we also had, you gave your psychiatrist permission to give us your history as well. So he's very helpful and forthcoming. So, yeah.
And, I have had 15 surgeries, and I mean, I would say the biggest fear is when I had the pulmonary embolism. Since then, nothing has been right. They said, my heart doctor said, from my age, 40, I was 40, to be in a room full of people that were in their 70s. He said it was a miracle that I was alive.
Well, I'm so glad that they found it and that you've been treated for it.
So I've been very scared since then, and so many things have happened since then.
But my question to you is, do you think this has gotten a grip on you to the point that you have stopped being Shamita and started being a patient? Has your identity become a sick person?
Yes.
Has your identity become a patient and not a mother, a sister, a friend, someone that has just become consumed by your medical history and activity?
I live every day only for my children.
But you're not living, Shamita.
Shamita is convinced that her family doesn't care about her and she is all alone in her living hell. She also accuses her sister Dana of betraying her. Well, tomorrow we're going to meet the rest of the family and hear what they have to say about Shamita and all of her problems.
Tomorrow on an all-new Dr. Phil.
This woman is addicted to being sick.
Is she a hypochondriac?
You stay in a room for 20 hours a day eating out of a Hello Kitty microwave.
Craving attention?
Do you see how everyone's taking care of you? How you're loving this?
You have verbally abused me.
How dare you, Mom?
You need to sit down and listen to your daughter.
This child has been given everything by me.
If you walk off this stage, our relationship is done.
That's tomorrow.
You don't want to miss that. I want to thank all of my guests. Go to drphil.com and let us know what you think. So long.
Hello, xin chào quý vị và các bạn đã quay trở lại với kênh của mình nhé. Hôm nay mình sẽ thiết kế một cái con sò. Đây. Con sò này mình sẽ cột dây chỉ để làm đồ chơi các bạn. Con sò này các bạn, thấp lắm, nó nhìn không thấy. Sẽ uống nước cái rồi mình sẽ tiếp tục làm các bạn nhé. Sáng ra trời nóng á, rồi mình sẽ cột cái con sò vào nha các bạn xem. Thì đây mình sẽ sử dụng một cuộn chỉ, các bạn. Mình sẽ lấy một khúc, đó các bạn, mình sẽ cột vô trong cái đầu tiên mình phải thắt cái lúc các bạn. Đó, sau đó là mình sẽ bỏ trong con ốc này các bạn. Ok chưa? Bạn nhìn thấy đẹp không? Tương tự vậy mình sẽ thắt thêm mấy cái lúc nữa để mình sẽ cột được nhiều hơn nha. Kiểu giống như mình sẽ làm một cái này đang là cái này mình sẽ gắn cái chiều của nó luôn. Đó, giống như một chiếc sáo, quên một cái chuông gió vậy các bạn. Cái này thì ra nó phải xuống thêm tí nữa mới đúng rồi. Nó xuống thêm tí nữa. Bị rối cái này các bạn, để mình xem. Hơi kỳ kỳ đúng không các bạn? Xoay quanh cái này được một cái đi, cái cắt khúc đi bạn ạ. Cắt khúc này đi nha. Lấy cái sẽ trồng từ trên xuống xuống như các bạn, để nó dễ. Kiểu lần đầu làm nên nó cũng hơi bỡ ngỡ các bạn. Ok, được một cái. Đến là cái thứ hai rồi. Ok chưa? Ố, nó bị tuột mất tiêu rồi các bạn. Cái này có nghĩa là phải có đường dây chỉ các bạn. Tôi ơi buồn làm gì. Ồ, cái này. Đó, làm nhiều nhiều lên nó sẽ thành cái chuông gió các bạn nhé. Sẽ cột nhiều lên nó sẽ thành một cái chuông gió cho các bạn xem. Sẽ làm thành một cái chuông gió cho các bạn xem nha. Này. Được rõ ốc luôn, rất là đẹp đúng không? Sau đó là mình sẽ cột nó lên như thế này luôn, thành một cái chuông gió để chơi. Rất là tuyệt vời đúng không ạ? Video của mình đến đây là kết thúc. Xin chào và hẹn gặp lại các bạn vào những video clip theo. Xin chào nhé.